There are encouraging signs in the fight against the coronavirus. More cities and states are announcing plans to reopen, including here in New York City, once the epicenter of the virus. This as Pfizer's vaccine is on track to get FDA emergency use authorization for children ages 12 to 15. For more on all of this, let's go to ABC News medical contributor, infectious disease specialist, Dr. Todd Ellerin. Thanks for being here, Dr. Ellerin.
Good to be here, Diane.
So this emergency use authorization for Pfizer's vaccine, kids 12 and up, it could come as early as this week. What effect do you think this could have, vaccinating middle schoolers and high schoolers, on reaching herd immunity and restoring a sense of normalcy?
I think this is really important, very encouraging. It will likely receive EUA. Remember, there are about 17 million kids between the age of 12 and 15. So, and we know that while they tend not to get very sick from this virus, we do know that rarely you do have kids that are hospitalized and rarely die from this. But also, it's the transmission, right? If you decrease infection in these kids, then you're going to decrease transmission overall to the adults and the older kids that, especially if they're compromised or have comorbidities, they can get very sick from this. So I think it's really important. And remember, the phase 3 trial that Pfizer showed is that this looks very safe, and this has to be viewed through a lens of safety. And so far, in the over 2,000 kids that were given the Pfizer vaccine, we've heard that it is extremely safe and a very robust immune response. So those two things together make it very likely that the vaccine will receive emergency use very soon.
Now, some experts are still saying that reaching herd immunity in the U.S. is now looking unlikely because daily vaccination rates are slipping. What do you make of that?
Yeah, I mean, I do agree with that. I want you to remember herd immunity, okay? So with the measles vaccine, where you have an amazing vaccine and you don't generate variants, we can have herd immunity, which we do. That's why we rarely hear about measles. With influenza, we don't really talk about herd immunity because we have a vaccine that has moderate effectiveness, and we know we have variants that come back every year. I think with COVID-19, it's somewhere in between. So it's possible that we might be able to get herd immunity, but even if we do, it may be temporary because of these variants. And of course, with vaccine hesitancy, if we have a third of the country that doesn't receive this vaccine, I agree, it makes even temporary herd immunity less likely.
Now, Republican Governor of Florida, Ron DeSantis, made headlines today by signing an executive order ending all local COVID-19 emergency restrictions. And I want you to listen to what he said.
I think that's the evidence-based thing to do. I think folks that are saying that they need to be policing people at this point, if you're saying that, you really are saying you don't believe in the vaccines.
Now, according to the CDC, 56% of Americans have received at least one vaccine dose. So what do you make of the governor's decision and his comment there?
Well, first of all, I'm really happy that Florida is doing well right now and that, case counts are decreasing. They're not being overwhelmed, with COVID hospitalization. So I think that's important. I do think that the key is whether you have executive orders or no executive orders, we know what people need to do. We need to vaccinate more because we know the vaccine is extremely safe and extremely effective, not just at preventing severe disease, but also preventing infection. And if you don't get infected, then at the same point, you can't transmit. We also know what things work, that the masks work. And while it's not as important to wear masks outdoors, especially if you're distanced, indoors, if you're not with your family or you're not with vaccinated people, it's still important. We know where the transmissions are occurring. So I think the common sense principles will take us far.
Now, tomorrow, the U.S. travel ban to and from India takes effect. And we keep hearing about the devastating scenes there. How did things get so bad in India? And what do you do to combat a surge that is this bad and this big?
Diane, my heart is breaking right now for India, just like it did previously in the United States. I mean, the bottom line is there's a lot of factors going on here. You have variants surging, and we know these variants are much more contagious. Remember, India is one of the most population-dense countries in the world, okay? The other things are vaccination. In the U.S., we have been vaccinating much more aggressively than in India, where the vaccine hasn't been as widespread, so they're missing a major tool. And you know that right now they're overwhelmed. You remember personally what that was like in New York City when there wasn't enough oxygen, there wasn't enough PPE, so they need global help from all of us to help them. But even bringing them oxygen isn't enough because they're having difficulty transporting from one place to another. So right now, if they don't get on top of this, there will be millions of Indians that are dying from COVID-19, and they have to be aggressive. This calls for shelter in place, these extreme measures that we in the United States were even too late in declaring. So that's what has to happen right now. It's a humanitarian crisis.
Now, on the flip side, over in the UK, thousands of people came out for this government-backed test concert in Liverpool. No masks, no social distancing, and they're hoping that this will help the process of reopening large in-person events. Really quickly, what are your thoughts on that?
Well, listen, I really hope that there's few infections from this. Here's the good news, right, with this experiment. It was outdoors, and they wanted people testing not just once, but potentially twice before they entered this concert. So I think with that, and of course with the vaccine that seems to be working, I'm hopeful that this won't, reverse the great strides that the UK has made as far as getting control of COVID-19.
All right, fingers crossed. Dr. Todd Ellerin, thank you as always.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.